Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. Today's episode is special as we have Dr. Daniel Paull of Easy Orthopedics. Dr. Paull is an orthopedic surgeon on a mission to change how we receive care, and it's very, very unique. Before we dive into this interview with him, though, we're just a message from our sponsor, Grow Solutions, where we transform passionate healthcare practitioners into profitable business owners without the overwhelm and guesswork. So Grow Solutions eliminates a lot of headaches, whether that's generating new patients for your business or your practice, patient communication breakdowns, operational chaos, which takes place quite often, unfortunately. So we implement some proven systems and frameworks. And yes, we implement AI and agents to allow you to enjoy your business and family life away from practice. So we're not an agency or vendor, we're a provider that helps you grow along with it. So if you've ever said this or heard this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. Just drop the word grow below or feel free to reach out to me on any social platform. But you're here today to meet our guest and hear his story. So it's Dr. Daniel Paull, again, the founder and CEO of Easy Orthopedics. Dr. Paull, welcome to the Prime Health Podcast, and tell us a little bit about yourself and what you do.
Hey, Derek, thanks for having me on. So, I have orthopedic surgeon by background. I've got a medical practice named Easy Orthopedics out in Colorado Springs, and it's been about 6 years. And it's kind of an interesting practice. There's only 2 employees. It's just me and my wife. And then I also don't have an office, so I'm mobile. And then I don't work with insurance companies either. So that is kind of it in a nutshell. It's always been like that. I've grown it over the years, but basically I travel around, go to people's houses, go to different offices, and I don't muck around with any insurances because I don't like them. I mean, there's a lot of reasons why they're bad, but that is sort of the skinny of it.
I like the skinny. It was bing, bang, boom. You got through enough of it right there, which is great. Very straight and to the point. It's unique, and we'll cover more of that. But I'm going to jump you back maybe into your history. Was there a moment or a life circumstance that happened to you that said, you know what, I'm going to choose a career in medicine?
Yeah, I mean, I come from a family of engineers, a lot of civil engineers. And when I was 14, I had a bad skiing accident. I broke my legs and my right arm and everything. Oh. And then they kind of pieced me back together. And I was like, whoa, this is kind of amazing. Like, it's so cool that they were able to do this. I'm like, I think this is what I want to do. And I made that decision at 14 years old. Now, it's a good story, and it's true. But, you know, when you're making decisions about your future life at 14 years old, you're not really considering all the variables. And then you can find out that your 35-year-old self gets stuck with this decision that your 14-year-old self made. So there's certainly elements of, like, you know, in medicine, a lot of us are so stubborn that we just say we're going to do it, and we do it, and I did it, you know, and I like what I'm doing, but I think there's something to be said about making your life decisions at such a young age before you have a lot of life experience.
Yeah. Yeah. Would you say that because of that accident you were in, is that what really drove you to orthopedic surgery?
Yeah, for sure. Absolutely.
Okay. All right. Now you've taken I guess as an orthopedic surgeon, tell me the first part of your career doing the typical traditional practice, and then guide us in that path that took you away from the clinic and hospital to the mobile practice.
Gotcha. So it's kind of I feel like it's a lot of times these things are well thought out, and people are like, well, I A, B, and C, and I'm measuring against D, E, F, and I'm going to go ahead and do it. But a lot of times in the real world, it's like more calamity. And I feel like for me, it was more calamity. So anyways, I go to medical school at University of Miami. That, it's good. I had a good, it was a lot of studying, but it was good. And then I matched into orthopedic surgery residency at University of Toledo. And that was good as well. I mean, it was 5 years. It was hard work. Learned a lot, worked really hard, did a lot of surgeries. And then I started a fellowship in hand surgery. So I was going to be just doing hand surgery. And it was not a positive educational experience. So it's only a year, right? I've already been through 4 years of med school, 5 years of residency. This is just a year. And I'm like halfway through this year, or about 5 months in. Maybe I had 7 months left. And man, I am just really miserable. And not only was I just miserable in the program, I was looking for a job, and all the ones I found were abusive at best. So, take our call for our entire practice. And my wife's from Colorado. We wanted to move out here because I'd been dragging her around the country at that point, right?
Right.
We wanted to move back somewhere to Colorado, and it's like, man, I can't find a job out here. So I looked for a job out in Connecticut, where I grew up. And it was just this old bitter senior partner telling me how much money he made in the early 90s. And I was like, he's talking junk about the previous hand surgeon, and he's talking junk about the hospital and the other groups. And I'm like, it kind of created this existential crisis where I'm like, am I just, because you're already grinding it out for a while, or at least it feels like a while between med school and residency. It's like 10 years. Certainly people grind it out for longer, but 10 years is a while. And it's like, man, am I going to be doing this forever? Is it just going to be always grinding it out, like until I drop dead? And it kind of created this existential moment in me. And I had this friend from medical school started a house call practice down in Miami. And he was like, man, I'm like, this guy's happier than anybody I know in medicine. And I'm like, he's also doing better financially. I'm like, there's got to be something here. And like, it kind of was this existential crisis combined with misery of this fellowship. And I just blew it all up. So obviously I stopped applying for jobs. I quit my fellowship, which is not normally done. And I'm very proud of that fact. It's easy to finish things like that. It's hard to quit them, I don't think that, you'll have this, people say like, oh, winners never quit. Like, maybe that's true in sports, but in life, you find the most successful people quit things all the time when they're not working, and they reshuffle their priorities and they find a way to win. I mean, but there's an element of quitting things that aren't working. So I'm proud of that. Anyways, I did that, and I moved out to Colorado into my in-laws' basement and just trying to figure out how the heck am I going to make this thing work. So that was kind of the origin of it. And again, that was 6 years ago. And, I've since moved out of my in-laws' house a while ago. So it's obviously working. Yeah. But yeah, that was kind of the origin of it.
Okay. Is there any pushback or misconception of people saying, hey, you're an orthopedic surgeon, shouldn't I be seeing you in the hospital or a clinical setting? I know that you do travel to offices to do that, but in a house call, they're pretty open to it, or is there pushback on it?
When I started, I was 100% house calls. Now I'm probably 10% house calls. So most of the time I'm in an office. It's not my office. So sometimes I use chiropractors' offices for the most part. So sometimes they'll be like, I didn't know you were a chiropractor. And I'm like, no, those aren't my diplomas on the wall. But yeah, in the beginning, there's, some people think it's weird. Like, oh, the house call, like doctors don't do that anymore, even though it really used to be very common. Like, and so there's sometimes like, and that's why you got to make sure that your pricing is appropriate, because if it's too low, like people will be too weirded out. So you got to make sure it's like the appropriate amount. Once we sit down and start talking, like all that fades away, and they realize that I'm trying to help them and they trust me. So it ends up being fine in the long run. But yeah, you certainly get that. I'm not as much anymore since I'm mostly office based, but you do get that.
Yeah. So what are the conditions that you will treat people for? What is it mainly the work that you're doing?
Mostly what I'm doing, you're right. I'm on the hospital, right? So if someone has a broken femur, like they're not coming to me, Yeah. It's a lot of like, at this point, kind of like chronic pain sort of things. Like, hey, my shoulder's been bothering me for 2 months. I don't know why. I've got this weird hip pain nobody can figure out. I've got back pain. I'm seeing the chiropractor. Chiropractor sends them to me to help with that, So we work together on that. So it's sort of, that is kind of my sweet spot at the moment. Or like, hey, I've been to 4 doctors and nobody can figure out my wrist pain. Like, that's the stuff I really like, but I'll also treat some, broken bones here and there and whatnot. But that's sort of what the practice has morphed into.
Okay. So pain conditions that are there, but, and then some of the treatments that you do are, I would assume, injectables, like you're doing pain meds or you're doing PRP, stuff like that.
Yeah, a lot of corticosteroids, some PRP. I don't really give pain meds out too much. I mean, maybe some Medrol dose packs or some muscle relaxers, but unless someone's broken a rib or broke a bone, I really try to stay away from any narcotic usage.
Okay. And is there the typical follow-up that takes place with that? I come in to see you with a shoulder injury, maybe it's a potential labral tear. We don't know. You're doing x-rays, imaging, MRs, those kinds of situations, and you treat it conservatively is what you would want to do, whether it's you with injections or referring out to PT. Does that kind of follow the path of care?
Yeah, it depends on what they're seeing me for. So I'll do personal injury as well. So as you know, those people are multiply injured. So those usually require a few follow-ups. But if it's just like your cash pay, like, hey, I just want a knee injection before I go on vacation, like usually I'm not, they just kind of see me as they need. And if they're not, how do I say this appropriately? If they're a normal human being, I'll give them my phone number and they can call me with any questions. And if we need to order an MRI, sometimes we'll order the MRI will get done and I'll call them about it, so they don't have to necessarily see me again. Obviously, if it's like a broken bone or something I casted, like I'll have to have a follow-up to take the cast off. Recently, we started bundling the cast on and cast off price because what I was finding was that I put a cast on and then they would never come back for the cast off, which means, like, first of all, nobody misses the cast off appointment. It just means they took it off themselves. So
Right.
I was kind of tired of that, where like, hey, they didn't follow up. And I was like, all right, well, you're paying for the cast off at the same time you're paying for the cast on.
Yeah.
I don't know what they're doing at home, but like I've got a very special cast saw and they obviously figure out some way to take it off, but highly recommend against doing that.
Yeah. When I first got out of school as a chiropractor, I worked with an orthopedic surgeon, and I remember we had a little girl that broke both of her forearms, and she was less than 5 years old. The surgeon, put the cast on her. She came back in 6 weeks later, and we used the striker saw to take it off. And it was so hard to explain to that little girl the buzzing of the striker saw.
Yeah.
The warmth that she was experiencing, fearful of it's going to cut her, I would assume. So, versus another situation. I remember in school, we casted a young kid that had a radial fracture. The day after he was casted, he went to a Cubs game. I went to school in Chicago. He went to a Cubs game, said he was eating peanuts. He came back 4 weeks later on that checkup, and he's like, boy, my forearms itched for probably the last 2 weeks. He literally had a peanut shell drop down in there. Then the experiences that you have on those are unique to themselves for sure.
Yeah, especially when she started getting into like long leg casts or like, God forbid, hip spica casts, which I don't do. Those are hard to put on. You find all sorts of stuff in there.
Yeah, for sure. So you tell me again. So you left the clinical setting where you were at, and now you you build relationships with other physicians, chiropractors in the area, and you'll treat their patients, or can you sometimes treat a patient that and utilize their practice as well?
Yeah, so for the most part, depends on the provider, the doc. Most of the time I'm seeing their patients at their office, but sometimes I'll throw in some of my own there.
Okay.
And they don't really mind. Like I have a bunch of different offices that I'm there sporadically. I don't use any of their front office staff. I'm not using their EMR. I'm like only using a room that sometimes is not being used anyways. I clean the room when I'm done. All the supplies are my own. So the only time I'll use their staff is if I'm injecting a female. I'll have a female MA come in the room with me. But, we have a good relationship and we respect each other. So they're fine with me doing that. And again, it's not like I'm dominant. I'm never like in the way. That's my goal. So I always tell them that, hey, if this is becoming an inconvenience for you, you need to let me know and we'll make it work. And most of them, they don't care at all. And then if there is an issue, they let me know. But yeah, there's some people I only see their own patients there, and there's others where, but sometimes they need the services that are in that building after I'm done with them. Not always, but it's an easy place to refer them. So it works out.
Yeah. So would you say that, I want to get into the insurance component because it's important that people understand this. And I had a conversation with a clinician counselor of how they don't take insurance. Insurance is becoming harder and harder. Insurance is not healthcare. It pays for coverage of healthcare. So why is it that you made that decision that you wouldn't be accepting insurances?
It's the only way to make it work, my friend. I mean, so if I take insurance, let's say I said I'm going to take insurance. First of all, I'd be out of business within a year. Okay. But let's say I did, I would need at least 5 people full time just to deal with that. Right. So, you do work, you expect to get paid for it, but that's not how it works in the insurance world. They make you jump through 100, dozen hoops, and then they don't pay you. And then you have revenue cycle management. It's just an unsustainable way to practice. From an economic standpoint and a business running standpoint, but also from, a practice of medicine standpoint. They force you into these small visits and you become a very fast, like a very high volume practice. These guys are barely keeping their head above water. So to me, it's just a recipe to practice crappy medicine because of the time constraints and like coding and stuff and things that you're more worried about charting than actual medical care. And then 2, it's a completely unsustainable way to run a practice, in my opinion. If you're a hospital system, you get these really good insurance contracts, fine. But if you're not in if you're not part of a hospital system, good luck getting them. And the smaller you are, the worse your contract's going to be.
Yeah.
And, it just seems like, look, man, if you're running a practice, you got to be able to set your prices and control your overhead, right? And you can't do that when you take insurance. You can't control your prices because they dictate that for you. And you can't control your overhead either because they make you jump through all these hoops and you have to supply the hoop jumpers. Yeah. So it's not a sustainable way to practice. And I think it's making medicine worse. And that's why I refuse to interact with these companies. Now, if somebody has insurance and they want to bill it on their own, I'll give them a super bill. Like, you have at it. But like, I'm not going to spend my time or my wife's time, the other practice member, doing that.
Yeah. Yeah, it's a great point. Again, people need to understand there's such a gap in the care that's provided by a provider. And then when the insurance company steps in, there's no reason Band-Aids should cost $25. There's just no reason for that at all. And for the way in which you practice, you have the ability of being easier on them. And as you said, which is great, Dr. Paull, that you said you give them a super bill. And that means that they can take that. This is what the doctor charged me. Throw it through my insurance, Blue Cross Blue Shield, whatever it may be. What can you at least reimburse me on that? And sometimes they'll get it and sometimes they don't, but they know that going in.
Yeah. And then they can blame their insurance company if they don't get paid. It's like, hey, that's not my fault.
Right. Right.
Blame your insurance company. And this is what they do. This is how they make money. Get lots of premiums and then they don't want to pay out. I mean, it's not hard to figure that out,
The people that are making the hospital or making the clinic the money are the ones that are abused in that environment. And then the CEOs that are on the top that are finding ways to cut off the money to the providers are getting continual raises year after year after year. It's an unfortunate cycle.
Yeah, if you look at the total costs, and I haven't looked at this chart in a while, but all of like physician expenses are like 7 or 8% of like total healthcare costs. And the rest is, you have equipment, but there's like administrative costs are like gargantuan. There's too many parasites sucking everybody dry here. So, that's all I did is I essentially just remove them all. And, what you find is a situation where you can do just as well and work a lot less and be a lot happier just because you're not shouldering 10 people around that, are making money off you.
Yeah. Well, I want to go back to the treatment and how you do this with injections or if it's PRP or if it's corticosteroid. Mm-hmm. We talked earlier. So there could be like a trust factor of, okay, this guy doesn't have an X-ray. He doesn't have an MRI. He can't do that. What do you do to make sure that you build trust with them of their care? And specifically you have an ultrasound device that assists with that.
Yeah. I mean, the diagnosis, some of them are clinical. Like a lot of times before I see them, they have all sorts of imaging. So they've already had all this stuff. If they haven't had that, I'll if it's trauma, like I fell and I can't walk, like I won't see them without an X-ray. Okay. So they get that before I see them. If it's like more chronic pain, we can get the X-ray afterwards, or sometimes we'll just get an MRI afterwards. If I know it's soft tissue, there's a high probability of the X-ray that's going to be normal, which is it's kind of hearsay in the world of orthopedics, as it's like they're getting X-rays on everybody before they come in the office. And I think that while it's useful, I think it's a little bit overutilized. But anywho, they have to do that before they get an MRI anyways. But in the world I'm in, I don't. So if I think it's more, makes more sense to just jump to the soft tissues and look at the soft tissues, we'll just do that. Yeah. Obviously the MRI will catch most of the stuff that X-ray would show anyways. Yeah. But how do I build trust with them? I think just by sitting down and listening to them and having time with them. For the injections, I do have a little ultrasound that I use if I need to use it. We'll talk about corticosteroid versus PRP, and depends on what they've got. If it's just some bursitis or tendonitis, well, I'm probably going to use corticosteroid. It's a lot cheaper and it works really well. But if it's some sort of joint or the joint's kind of deteriorated or they've sort of a labral tear or a small labral tear or then we start thinking about, doing PRP. Mm-hmm. Because PRP takes a while to start working and they're in pain for a while. So I just try to do what I think makes the most sense based on, who I'm seeing.
Yeah. Well, most people are using the X-rays or the MRIs to tell them what's wrong versus every once in a while, if you just listen to somebody like you're doing knee to knee, pressing the flash, you're hearing what the story was. You don't always need them, but when you do need them, like you're saying, you're referring out to get to that point.
Yeah. Yeah. No, I think the clinical, you should not be ordering an MRI where it's like, I don't know what's going on here, so I'm going to order an MRI. Usually you should be like, I think it's A, B, or C. Right. I'm ordering the MRI to see if it's those things and also to make sure it's not D. And granted, sometimes things are very confusing and you do end up getting the MRI. But the problem is if you do that, then there's a lot of incidental findings, and especially if you don't look at your own MRIs, like how are you going to make heads or tails of all the stuff that's in there if you don't know what you're looking for and you don't even look and read them? So that's a frustration I have with certain providers, physicians in the community that I'm in, and really any community, where it's like they don't really understand that. And I think, as you know, as someone a musculoskeletal expert, like there's people like you and me who only do musculoskeletal care. I don't treat diabetes. Like I don't do any of that.
Yeah.
And sometimes people who do all that stuff kind of think they can just also do musculoskeletal care. And in my opinion, they don't do it very well.
Right.
As I wouldn't do well if I started treating diabetes, right?
Very good. Yeah.
Like you wouldn't want to see me for that.
Yeah. Touche. Completely understand. So as far as conditions, you kind of said what you treated, but do you do spine, meaning neck, mid back, low back, and then you do elbows, shoulders, knees, hips, ankles, all that?
Yeah, so I'll very much treat anywhere on the extremities. As far as spine goes, probably the deepest I go is the SI joint. But I'll do triggers and SI joint injections, or like subscapular injections I find work really well for like kind of like a nebulous thoracic pain. Those work good. But I'm not really doing like facet joint. I'm not doing epidurals. I'm not doing like intraspinal stuff. That's more, if they really need that, then we'll send them out to pain management.
Got it. Okay. From a business approach, do you see that there are specific conditions that you are seeing more of in the last 1 to 2 years? Is there an epidemic of something happening that you're seeing more of?
That's hard to answer. I don't know that I have seen that. I mean, I see a whole smattering of stuff.
Okay.
So it's not like I've noticed more people coming in with tennis elbow or anything like that.
Got it.
But, I'm sure there's trends out there that I'm just not seeing the volume to kind of appreciate. Or, you got to realize my patient population is a little different because I'm not taking insurances. So, I don't have like, for an orthopedic doc, I don't have like a very old population.
Yeah.
Like a lot of them do, because, that's who's coming in, people that are, over 65, 70s or 80s. So, I'm not noticing any trends per se, but that doesn't mean that they're not there.
Right. Understood. Dr. Paull, from a business perspective, where's your focus right now as far as growth?
Growth for me is making sure the relationships I have in the community are good. I like who I'm working with. That's very important. I don't want to work with anybody I don't really like. It's just not good for business, because you end up having different value systems and it makes it hard. So like I'm small business, and a lot of people think like, oh, but you want to be big business and middle. I mean, you can still do really well with small business. So I'm very much in the small business world. It's just keep growing, keep doing my thing, and keep getting more referrals probably would be the best for me. There's always a musculoskeletal cost containment for self-funded insurers that I've always wanted to crack that nut, but it's just too hard to crack. So I've kind of, you got to put your effort where what's already working, not the stuff that's not. So that's certainly a frustrating area that I've always wanted to expand into, that for various reasons is very difficult.
Okay. All right. Understood. What would you say is the biggest challenge that your business faces today?
I think the biggest challenge with a practice like mine is like convincing people like, hey, this is a better way of doing it. I feel like I've done that at this point. I mean, I think with anything, it's just making sure that you have that people are referring to you, that you're getting people come. Well, I don't have a door, but that you're getting referrals and seeing people like that. If you have referrals, then you have a business. If you don't, then you don't. So that's always been, a very slow organic growth, which has been good. But, that's sort of always what, that's kind of the lifeblood of the whole business.
It is. If there's a practice that's 100% dependent upon referrals, it's tough to scale that business. But when you do a great job, it's always easy because somebody's like, I tried something different. I didn't go to see a doctor at the hospital. I went to a clinic and saw an orthopedic surgeon and got an injection. Completely different process. Great doc, explains everything to me. I think you need to give him a call to see what he can do for you. And that's all you can do. That's what success looks like to you, is when your patient is happy.
Yeah, the word of mouth marketing is the slowest, but it's the best there is.
Yeah,
and
absolutely.
So we've gotten certainly more of that over the years, but it's taken a while. You got to remember, I'm a low volume practice, so it's a trickle, and it just takes a long time to sort of convince people, that like, oh, this is working. And over time we've done that, but it takes time. I mean, I'm a lot busier now than I used to be.
Okay,
You know,
good. Well, it's because you work hard. That's important.
I
Can you
try.
share, yeah, can you share a success story of, people maybe coming in and doubting what you could do, or what can you share that's been a successful venture for you?
Um, I mean, from the business standpoint, people just thinking that it was going to fail immediately, right? Like you can't do that. It's never going to work. And then years later, I'm still doing it. So I think there's a lot of naysayers. Like if you don't take insurance and you're not doing it like this classical way, like you're going to fail. But honestly, I think that if you do it that way, you're going to fail. And if you don't do something different, you're not going to be successful. So I think that's been a big success where they're like, okay, like say my co-residents, right? From residency, they're getting out of fellowship, which remember I quit, and they're making like tons of money. And I'm just in the basement rubbing sticks together, like trying to get anything going here. And, first they're like, I think they felt bad for me. They're like, I don't know what happened, but then times are changing, right?
Yeah.
So now I'm doing just as well as they are, at least some of them. And I'm working a lot less, and like they're disgruntled. They're they're in the OR all the time. They're getting tired of it, and they're like surviving. And not meanwhile, I'm like, I don't have any of those same problems they have. So things have shifted sort of over the years. I think the longer I do it.
Yeah. And it's a unique perspective that you do have, friends that you went through school with, and they can experience, what's happening. There's a problem in healthcare that they're dealing with. And then I'm sure the burnout factor is higher for them than potentially you. Not that you can't have burnout effects in your practice, whether you're a low volume or even a higher volume practice, but you probably have a better work-life balance than they do.
Oh my God. Yeah, it's like unmatched. I think you can't compare it. I mean, like, because I'm not working for a hospital, so I don't have any call. I mean, patients call me.
Yeah.
So I decided I don't work on weekends. I don't return any calls on weekends unless it's an absolute emergency, which in my line of work, I mean, look, I'm not an emergency service, and it's rare that there's like a real orthopedic like emergency. So yeah, I have all my weekends. I don't have to go to the hospital. I don't have to round. I don't have to deal with any of these hospital voluntold positions. I don't have, I mean, there's so much BS that. So I have a friend, hand surgeon, went to residency with me, and he had some sort of cost sharing or cost agreement with a surgery center, so he'd make a percentage of the facility fee. So after a few months, they ended up paying him like less than $1,000. They're like, well, when you factor in A and B and C and D and E and F, and he's like sitting here so angry.
Yeah.
Meanwhile, these guys are fiddling away with these numbers to not pay him anything. I mean, I just don't have those headaches. Yeah. If there's something I don't really like doing, for the most part, I just excise it from my practice. But yeah, it's just lack of control. Those guys just can't control their situations, and I can. I don't let anybody bill on my behalf, and I think that's been good for my that's made me able to do this for so long.
Yeah. So what would you say to that doc that's an orthopedic surgeon, or it could be a pain doc, or it could be PM&R that's listening to this or watching this, and they're like, what does he have that I don't? What would you tell them to consider to take that leap of faith?
Yeah, I think to create a business, you just need some creativity and the ability to take risk. So it's possible, it's doable. I hope more people emulate it. I actually made a course it's called insurancefreemedicalpractice.com, where you can get some CME credits, and it shows you how I built my whole course. I built my whole practice. But yeah, it's doable. You just got to be willing to do it and make this, and you're not going to have money for a bit when you start with any business. So you have to make some sacrifices, but if you do it and you do it right, you'll be much happier that you did and much better off. But yeah, you certainly get some naysayers like, well, that wouldn't work where I am. I'm like, well, if you say it won't work, then it won't.
Exactly. Yeah.
But like, it's worked for me, and I'm in a competitive market where there's a high percentage of people that have insurance.
Mm-hmm. Yeah. And I'm sure in the Colorado area, there's plenty of hospitals around where people think of that's the place to go.
Mm-hmm.
Yeah. Yeah. So what's the vision for Easy Orthopedics over the next 3 to 5 years?
I think we just want to keep staying ultra independent and keep doing what we're doing, and probably stay ultra minimalist while continuing to grow little by little, the work that I do, whether it's cash, personal injury, medical legal work, or consulting or anything like that. Yeah, I mean, it's doing well. I just want to keep doing what I'm doing, just more of it,
Okay. All right. I love the approach. It's simplified, but it's your approach. That's what, that's what makes you and your wife happy and your family happy, which is great.
Yeah. Some people want to like expand to the moon, and that's good. Like, that's a lot of people have just made, changed the world by that and made fortunes. But the more I'm in the world of small business, like the more I like it, you know?
Well, that's good. I love to hear that. There are people that are afraid. I was just listening to a video that was 51 seconds long about taking the leap of faith. Most are afraid to do that. You don't know where you're going to land. You know if and or when you're going to land. And for the most part, the life outside of the risk zone / comfort free zone is a much better life. It's not always fun to get there outside of that box. It's not always fun, but once you're there, it's rewarding for sure.
Yeah, I agree.
Yeah. So as people are watching or listening to this, they want to learn more about you and hear how you've done it. Or if there's a patient that's in your community that wants to, get connected with you, what's the best way in which they can get in touch with you?
I think the best way is if you have our website, it's easyorthopedics.com. And we have basically everything on there. We have a YouTube channel. It's youtube.com/@orthopedics. That's more like informational videos. And I think LinkedIn, I'm on a fair amount. Okay. It's Daniel Paull, MD. So those are probably the best ways to get in contact with us. But yeah, if you want to get in contact with us, just shoot us an email on our contact form or call us up and, we'll talk.
All right. Love the approach. So 2 last questions for you, Dr. Paull. If you could give one piece of advice for anyone that's watching or listening to this that would allow them to lead a healthier way of life in a positive way, what would that advice be?
I'll kind of skew this towards my expertise of starting one of these businesses. So it may not quite be a health recommendation, but I would say if you are thinking about starting one of these businesses, the main key is 1, don't interact with insurance companies, and 2, don't let anybody bill on your behalf. Nobody gets to bill for work I've done and then pay me a percentage of it. If you can do that, you'll do really well because most people don't understand how many people have their fingers in the pot. So if you can remove them, then, you'll do well.
Yeah. Your point is well taken from a history lesson of myself of not letting anybody bill on your behalf. I remember when I was at a practice in Chicago, I was on vacation. I called the office because I had to ask them a question. I could hear people in the background. I wasn't there. Nobody should have been there except for the staff and a massage therapist that would see their own patients. But apparently they were bringing my patients in to bill them for services when I was gone. So I had to turn in the practice I was working at because they were practicing a little bit outside of the norm. Yeah, you don't want to be put in that position.
Especially for billing. I don't know if you're billing Medicare or not, but man, that's a dangerous.
Yeah.
That gets real dangerous real fast. Don't do that.
No, not at all. So you've been a great guest on the Prime Health podcast. I asked this of everybody. What would your definition of Prime Health be?
I think Prime Health, obviously you want to be healthy and avoid the doctor if you can. But if you need to go and see the doctor, you want to make sure that it's a time element, that they're spending time with you. You can't compress medicine down infinitely without losing quality. And I think that's sort of where we're at. So I think time-based medicine is usually a much better way of getting care.
Yeah, love it. I appreciate you sharing that. Everybody's got a different definition, and that's important. So Dr. Paull, again, thank you very much for being a guest on our podcast. You bring some very unique perspective that we haven't had here before. We have some individuals that are, they're private practice, but not all cash-based and not taking the leap from being an orthopedic surgeon in a facility to running your own practice that way. And I appreciate the fact that you have ways in which people can learn to do that. It gives us a better understanding of the full spectrum of what healthcare is and or what healthcare can be. And from your insights, truly on the business perspective too. So, again, appreciate it. I always ask people that if you're listening to this or you hear it, you watch it, if there's a patient or a family or friend that could benefit from this, or if you know that there's a doc that's out there that's maybe struggling and wondering what the options are, please make sure you share this with them. It's always important that we can get this in front of more people that have to hear about it, see about it, and learn about it. And of course, selfishly, I always ask, subscribe to the Prime Health Podcast, whether it's on YouTube, Apple, or Spotify. We appreciate all those. But until next time, remember that true wellness is a journey we are all on together. Whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So stay committed to your Prime Health journey. And again, Dr. Paull, thank you very much for being a guest on the Prime Health Podcast.
Thanks for having me.